Episode 1, Will Trump's Medicare, Medicaid cuts leave therapists without a job? Therapists across the country are facing uncertainty as Trump's proposed healthcare cuts threaten to reshape mental health care as we know it. If these cuts happen, will thousands of therapists lose their jobs or agencies? And what will happen to the patients, citizens who rely on Medicaid for mental health and substance abuse treatment? In today's video, we're diving deep into what's at stake for both therapists, counselors, and patients, and what can be done to prepare for how will these cuts impact therapists and addiction treatment centers. Potential. The biggest concern for therapists is simple. Fewer Medicaid-covered sessions mean less income. But for addiction treatment providers, the stakes are even higher. Medicaid is one of the largest payers for substance use disorder treatment in the U.S. If fewer people can afford therapy or rehab services, private practices, community mental health clinics, and substance abuse treatment centers could struggle financially. This may lead to fewer available therapy appointments, longer wait lists for substance use treatment, reduced access to medication-assisted treatment, MAT, for opioid addiction. Practical tip. If you're a therapist or addiction counselor, now is the time to explore alternative funding streams, offering sliding scale services, telehealth, or private pay options. Changes. How will these cuts impact our patients? Patients on Medicaid, Medicare already face challenges finding therapists and addiction counselors who accept their insurance. If funding is cut, wait lists will grow, and many individuals may lose access to affordable mental health and substance use disorder treatment entirely. For those struggling with addiction, losing access to therapy, medication-assisted treatment, or residential programs could increase relapse rates and overdoses. Medicaid currently covers nearly 40% of people with opioid use disorder. What happens to them if these services disappear? Mental health and addiction treatment should not be a luxury. Everyone deserves access to care, regardless of income. But if these changes happen, we need to prepare for a shift in how therapy and rehab services are accessed. What can therapists and patients do to prepare? If you're a therapist or substance abuse counselor, now is the time to stay informed and diversify your practice. That could mean expanding into telehealth, joining private insurance networks, or advocating for policy changes. If you're a patient who relies on Medicaid for mental health or addiction treatment, consider speaking with your provider about potential options. Some clinics offer grant-based funding or sliding scale fees to help people stay in treatment. Final takeaway. No one can predict exactly how this will play out, but being informed and prepared is key to navigating potential changes in the mental health and addiction treatment field. Closing and call to action. What do you think about these proposed Medicaid cuts? How would they impact you as a therapist, addiction counselor, or patient? Drop a comment below and let's discuss. Subscribe for more mental health and policy updates. Don't forget to like and subscribe.